Phlebotomy exam day tips. Question 1. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A. Routine cholesterol screen. Option B. Workplace drug testing. Option C. Blood culture for endocarditis. Option D. Complete blood count for anemia. The correct answer is option B. Workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 2. What type of isolation precautions must be followed when entering a room to draw blood from a patient with an active vancomycin-resistant enterococcus, VRE, infection? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Protective reverse isolation. The correct answer is option C. Contact precautions. VRE is commonly spread by direct contact with contaminated hands, surfaces, or equipment. Contact precautions use gown, gloves, and dedicated equipment to reduce transmission. Airborne and droplet precautions are reserved for respiratory spread. Question 3. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A. Artery. Option B. Capillary. Option C. Vein. Option D. Arteriole. The correct answer is option C. Vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 4. Which of the following elements is a primary link in the chain of infection? Option A. The source or reservoir of the pathogen. Option B. The cost of personal protective equipment. Option C. The layout of the outpatient laboratory facility. Option D. The brand of antiseptic wipes used to clean benches. The correct answer is option A. The source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 5. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option A. 1.0 mm. Option B. 2.0 mm. Option C. 3.0 mm. Option D. 4.0 mm. The correct answer is option B. 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 6. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A. Green top. Option B. Light blue top. Option C. Lavender top. Option D. Yellow top. The correct answer is option A. Green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 7. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A. Rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 8. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT instruments. Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 9. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 10. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B, releasing the tourniquet as soon as the first tube begins to fill with blood. Option C, utilizing a needle with a large lumen, such as a 21-gauge needle. Option D, having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 11. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 12. What is the function of the thixotropic gel inside an SST or PSD tube? Option A, to accelerate the coagulation cascade. Option B, to form a physical barrier between cells and serum/plasma during centrifugation. Option C, to preserve glucose levels for up to 24 hours. Option D, to chelate calcium and prevent fibrin formation. The correct answer is option B, to form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 13. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 14. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A, releasing the tourniquet within 1 minute of needle insertion. Option B, keeping the patient's arm down during the venipuncture procedure. Option C, allowing the patient to pump their fist repeatedly before and during the draw. Option D, transporting the specimen to the laboratory within 30 minutes. The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 15. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 16. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A, wearing a laboratory coat. Option B, utilizing self-sheathing safety needles. Option C, hand washing after every procedure. Option D, disposing of waste in a biohazard trash bag. The correct answer is option B, utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 17. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A, directly from the foreline itself. Option B, from the left arm. Option C, above the foresight on the right arm. Option D, from the hand on the right arm. The correct answer is option B, from the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 18. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 19. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A, sodium citrate. Option B, EDTA. Option C, heparin, lithium, ammonium, or sodium. Option D, potassium oxalate. The correct answer is option C, heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 20. What should a phlebotomist use to clean a workspace surface that has been contaminated by a blood spill? Option A, 70% isopropyl alcohol. Option B, a 1:10 dilution of sodium hypochlorite, bleach. Option C, plain warm soap and water. Option D, concentrated chlorhexidine solution. The correct answer is option B, a 1:10 dilution of sodium hypochlorite, bleach. Blood spills should be disinfected with an appropriate bleach dilution or approved hospital disinfectant. A 1:10 sodium hypochlorite solution is commonly used because it inactivates many blood-borne pathogens. Soap and water alone remove soil but do not provide adequate disinfection for a blood spill. Question 21. What is the correct action if a phlebotomist cannot find a suitable vein in either of the patient's antecubital fossae? Option A, probe blindly in the area where the median cubital vein should be located. Option B, inspect the dorsal aspects of the patient's hands for accessible veins. Option C, attempt a venipuncture on the inside aspect of the patient's wrist. Option D, draw blood from a vein located on the anterior aspect of the lower leg. The correct answer is option B. Inspect the dorsal aspects of the patient's hands for accessible veins. If antecubital veins are not suitable, the dorsal hand veins are the usual next site to inspect. They require careful anchoring and often a smaller device because they are more fragile. Blind probing or using wrist and lower extremity sites increases risk and may require special approval. Question 22. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 23. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option A, light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 24. Which of the following blood components is responsible for the initiation of the coagulation process? Option A, erythrocytes. Option B, leukocytes. Option C, thrombocytes. Option D, hemoglobin. The correct answer is option C, thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 25. What is the correct order of draw for a capillary puncture when collecting multiple microcollection tubes? Option A, serum tubes, heparin tubes, EDTA tubes. Option B, EDTA tubes, other additive tubes, serum tubes. Option C, heparin tubes, EDTA tubes, serum tubes. Option D, serum tubes, EDTA tubes, heparin tubes. The correct answer is option B, EDTA tubes, other additive tubes, serum tubes. Capillary order of draw places EDTA specimens first, followed by other additive tubes and then serum tubes. This order helps prevent microclot formation in small volume hematology specimens. Venipuncture order cannot simply be applied to skin puncture collections. Question 26. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A, prone position. Option B, high Fowler's position. Option C, supine with legs elevated or flat. Option D, standing upright with assistance. The correct answer is option C, supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 27. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A. Draw the blood from a capillary puncture if the tests allow. Option B. Turn off the for yourself and draw above the line immediately. Option C. Draw from the foot or ankle without a physician's order. Option D. Postpone the draw indefinitely until the patient is discharged. The correct answer is option A. Draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 28. Which of the following is an example of an implied consent scenario? Option A. A patient signs a formal document for an invasive procedure. Option B. An unconscious emergency room patient requiring urgent diagnostic lab work. Option C. A patient verbally states they agree to the blood test. Option D. A parent signs a waiver for their underage child. The correct answer is option B. An unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 29. Which of the following tests requires that the sample be protected from light by wrapping the tube in aluminum foil? Option A. Vitamin B12 and carotene. Option B. Blood urea nitrogen, BUN. Option C. Partial thromboplastin time, PTT. Option D. Complete blood count, CBC. The correct answer is option A. Vitamin B12 and carotene. Vitamin B12 and carotene are light sensitive and may require protection with foil or an amber container. Light exposure can degrade sensitive analytes and produce inaccurate results. BUN, PTT, and CBC do not have the same routine light protection requirement. Question 30. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A. SST, light blue, blood culture. Option B. Blood culture, light blue, SST. Option C. Light blue, SST, blood culture. Option D. Blood culture, SST, light blue. The correct answer is option B. Blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 31. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A. Basilic vein. Option B. Cephalic vein. Option C. Median cubital vein. Option D. Brachial vein. The correct answer is option C. Median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 32. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A. Pearl/white top with gel barrier. Option B. Light blue top. Option C. Gray top. Option D. Yellow top with SPS. The correct answer is option A. Pearl/white top with gel barrier. Pearl or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 33. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 34. Which of the following veins is located on the medial, inner, aspect of the antecubital fossa and is close to the brachial artery? Option A. Cephalic vein. Option B. Basilic vein. Option C. Median cubital vein. Option D. Radial vein. The correct answer is option B. Basilic vein. The basilic vein is located medially on the inner side of the antecubital area. It lies closer to the brachial artery and median nerve than the preferred veins. This anatomical relationship is why it is usually avoided unless necessary. Question 35. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act? HIPAA. Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 36. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A. Syncope. Option B. Shock. Option C. Vertigo. Option D. Hemastasis. The correct answer is option A. Syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 37. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A. Clear or plain red glass top. Option B. Light blue top. Option C. Lavender top. Option D. Light green top. The correct answer is option A. Clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 38. What type of fluid is obtained during a lumbar puncture procedure? Option A. Pleural fluid. Option B. Synovial fluid. Option C. Cerebrospinal fluid, CSF. Option D. Peritoneal fluid. The correct answer is option C. Cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 39. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B. The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 40. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 41. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 42. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas (ABG) draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 43. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A, basic metabolic panel, BMP. Option B, forensic drug analysis or paternity testing. Option C, therapeutic drug monitoring for digoxin. Option D, blood culture tracking for endocarditis. The correct answer is option B, forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 44. What occurs during the pre-analytical phase of laboratory operations? Option A, running standard controls on a chemistry profile machine. Option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C, interpreting a bone marrow biopsy under a microscope. Option D, transmitting final electronic medical record entries to billing. The correct answer is option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 45. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option A, recapping the needle before throwing it away. Option B, placing the needle in a biohazard bag. Option C, activating the safety device and placing it in a sharps container. Option D, dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C, activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 46. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 47. Which of the following options describes the best method to prevent a vein from rolling during needle insertion? Option A, tying the tourniquet directly over the intended puncture site. Option B, anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Option C, having the patient pump their fist continuously during needle insertion. Option D, inserting the needle quickly at a sharp 90-degree angle. The correct answer is option B, anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Anchoring pulls the skin taut below the puncture site to stabilize the vein. This prevents rolling and allows a controlled needle entry. Tying the tourniquet over the site, fist pumping, or using a steep angle can increase injury or specimen problems. Question 48. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A, drawing blood from a patient who has explicitly refused the procedure. Option B, making a minor clerical error on a specimen tube label. Option C, forgetting to wash hands between routine patient encounters. Option D, accidentally causing a small hematoma during an authorized draw. The correct answer is option A, drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 49. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A, hematoma. Option B, hemolysis. Option C, petechia. Option D, ichthyosis. The correct answer is option C, petechia. Petechia are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 50. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 51. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 52. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A, sodium polyethylene sulfonate, SPS. Option B, acid citrate dextrose, ACD. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option B, acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 53. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A, royal blue top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, grey top tube. The correct answer is option A, royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 54. What does the term homeostasis mean? Option A, the stoppage of blood flow from an injured vessel. Option B, the steady state or dynamic balance of the body's internal environment. Option C, the destruction of old red blood cells in the spleen. Option D, the production of new cellular elements in the bone marrow. The correct answer is option B, the steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 55. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 56. Which of the following errors is an example of a post-analytical error? Option A, failing to mix an EDTA tube, causing a microclot to form. Option B, mislabeling a patient's name at the bedside drawer. Option C, delayed reporting of critical panic values to the attending physician. Option D, leaving a tourniquet on a patient's arm for 3 minutes. The correct answer is option C, delayed reporting of critical panic values to the attending physician. Delayed reporting of a critical value occurs after analysis, so it is a post-analytical error. Timely communication of panic values is essential because treatment may depend on rapid notification. Collection, labeling, and tube mixing errors occur before analysis. Question 57. Which of the following statements is true regarding a multisample needle gauge? Option A 21-gauge needle has a larger opening than a 22-gauge needle. Option B, an 18-gauge needle is smaller than a 23-gauge needle. Option C, the larger the gauge number, the larger the needle lumen. Option D, all needles used in phlebotomy have the same internal diameter. The correct answer is option A, A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely: the higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 58. What is the function of platelets, thrombocytes, in the human body? Option A, transporting carbon dioxide back to the pulmonary system. Option B, producing specific antibody proteins to neutralize viral particles. Option C, participating in primary hemostasis by aggregating to form a platelet plug. Option D, maintaining systemic core body temperature variations. The correct answer is option C, participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 59. Which of the following conditions is characterized by a dangerous drop in blood volume, causing pale skin, rapid pulse, and hyperventilation? Option A, hypovolemic shock. Option B, septic shock. Option C, anaphylactic shock. Option D, cardiogenic shock. The correct answer is option A, hypovolemic shock. Hypovolemic shock results from dangerously reduced circulating blood volume. Signs may include pale cool skin, rapid pulse, low blood pressure, anxiety, and hyperventilation. Septic, anaphylactic, and cardiogenic shock arise from different mechanisms. Question 60. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A, complete the draw quickly and label the tube as venous blood. Option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C, leave the tourniquet tied tight to prevent a hematoma from forming. Option D, instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 61. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A, 5 to 10 degrees. Option B, 10 to 15 degrees. Option C, 30 to 45 degrees. Option D, 60 to 90 degrees. The correct answer is option B, 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 62. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 63. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 64. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A. Advance the needle deeper to see if the pain stops. Option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C. Tell the patient that minor discomfort is completely normal for this vein. Option D. Instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 65. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A. Resin or activated charcoal particles. Option B. Sodium polyant whole sulfonate, SPS. Option C. Acid citrate dextrose, ACD. Option D. Thixotropic gel barrier. The correct answer is option A. Resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 66. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A. Collecting the sample while the patient is crying intensely or under extreme stress. Option B. Chilling the specimen on an ice slurry before transport. Option C. Protecting the collection tube from direct artificial room lights. Option D. Allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A. Collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis. Question 67. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A. Hold the needle steady inside the vein to complete the draw. Option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C. Place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D. Restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 68. What type of vessel links the smallest arterial pathways with the smallest venule pathways? Option A. Capillary. Option B. Sinusoid. Option C. Lymph duct. Option D. Deep artery. The correct answer is option A. Capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 69. Which of the following is a symptom of nerve injury during a venipuncture? Option A dull ache in the antecubital fossa. Option B. A sharp, radiating, electric-like pain down the arm. Option C. A sudden feeling of warmth at the puncture site. Option D. Small red spots spreading around the arm. The correct answer is option B. A sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 70. Which of the following parameters must be strictly managed when collecting an arterial blood gas (ABG) sample? Option A. Protecting the syringe from exposure to direct light sources. Option B. Ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C. Inverting the syringe 20 times to mix the clot activator. Option D. Using a gray top tube to transport the arterial blood. The correct answer is option B. Ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 71. What is the primary purpose of the Joint Commission's National Patient Safety Goals, NPSG, in phlebotomy? Option A. To reduce the cost of laboratory testing instruments. Option B. To improve the accuracy of patient identification and eliminate diagnostic errors. Option C. To mandate the exact number of draws a phlebotomist must perform per hour. Option D. To regulate the salaries of medical laboratory technicians. The correct answer is option B. To improve the accuracy of patient identification and eliminate diagnostic errors. The National Patient Safety Goals emphasize accurate patient identification to reduce diagnostic and treatment errors. In phlebotomy, this directly affects bedside identification, specimen labeling, and matching the order to the patient. The goals are not designed to set draw quotas or regulate laboratory salaries. Question 72. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A. Activated partial thromboplastin time, APTT. Option B. Prothrombin time / international normalized ratio, patient / INR. Option C. Bleeding time determination. Option D. Complete blood count, CBC. The correct answer is option B. Prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 73. What tube additive prevents clotting by binding or chelating calcium? Option A. Lithium heparin. Option B. DDTA. Option C. Sodium polyant whole sulfonate. Option D. Thrombin. The correct answer is option B. EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 74. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A. Collecting blood from a patient with a suspected MRSA skin infection. Option B. Drawing samples from a patient diagnosed with measles or active varicella. Option C. Performing venipuncture on a patient with seasonal rhinovirus. Option D. Collecting a lipid panel from a patient with hepatitis C. The correct answer is option B. Drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 75. What is the function of the systemic circulatory system? Option A. Moving blood exclusively between the heart and the lungs for gas exchange. Option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C. Filtering liquid waste products through the nephron beds of the kidneys. Option D. Producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 76. What should a phlebotomist do if they observe a hematoma forming rapidly under the skin surface while performing a venipuncture? Option A. Adjust the needle angle to try to drain the hematoma into the collection tube. Option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. Option C. Instruct the patient to pump their fist forcefully to redistribute the blood. Option D. Advance the needle deeper to pass completely through the hematoma layers. The correct answer is option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. A rapidly forming hematoma means blood is escaping from the vessel into surrounding tissue. The draw should be stopped, the tourniquet released, the needle removed, and firm pressure applied. Continuing the attempt can enlarge the hematoma and increase pain or bruising. Question 77. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A. The functional capacity of platelets to adhere to vessel linings. Option B. The extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C. The total count of circulating red blood cells per microliter. Option D. The efficiency of the kidney to filter out waste urea molecules. The correct answer is option B. The extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 78. Which of the following is an example of an analytical component of quality assurance? Option A. Double-checking patient identity wristbands. Option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Option C. Delivering critical panic results to a physician on time. Option D. Labeling the collection tubes at the bedside. The correct answer is option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 79. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A. Use the partial sample anyway and send it to the lab. Option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood-to additive ratio. Option C. Pour blood from a green top tube into the light blue tube to top it off. Option D. Shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood-to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood-to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 80. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A. Using a needle with a large lumen, such as an 18-gauge needle. Option B. Drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C. Inverting a serum separator tube gently 5 times after collection. Option D. Centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B. Drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 81. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A. Interpreting abnormal lab results for patients. Option B. Ensuring specimen tubes are collected, labeled, and transported correctly. Option C. Changing medication doses based on therapeutic levels. Option D. Performing complex tissue biopsies in the operating room. The correct answer is option B. Ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 82. What is the clinical purpose of performing a bleeding time test? Option A. To evaluate the integrity of the intrinsic coagulation pathway. Option B. To assess platelet function and the capillary bed's ability to form a primary plug. Option C. To measure the absolute concentration of fibrinogen molecules in plasma. Option D. To screen the body for active systemic bacterial infections. The correct answer is option B. To assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 83. What type of collection is performed to screen for hidden blood in a stool specimen? Option A. Occult blood test, GWAOC. Option B. Culture and sensitivity, C&S. Option C. Dova and parasites, O&P. Option D. Fecal fat quantification. The correct answer is option A. Occult blood test, GWAOC. An occult blood test, often using a GWAOC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 84. Which of the following items must be included on a computer-generated barcode specimen label? Option A. The patient's diagnosis and name of their insurance carrier. Option B. Unique patient identifiers, date, time of collection, and phlebotomist ID code. Option C. The phone number of the patient's next of kin. Option D. The laboratory technician's home address. The correct answer is option B. Unique patient identifiers, date, time of collection, and phlebotomist ID code. A barcode specimen label must include unique patient identifiers, collection date and time, and collector identification. These elements support traceability from bedside collection through laboratory reporting. Insurance information and unrelated personal data do not belong on the tube label. Question 85. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A. Allowing a serum separator tube to clot completely before centrifugation. Option B. Balancing the centrifuge correctly with tubes of equal volume. Option C. Centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D. Keeping a plasma specimen chilled on an ice slurry. The correct answer is option C. Centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 86. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A. Transporting the specimen to the laboratory on ice. Option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C. Using a green top tube containing sodium heparin. Option D. Labeling the specimen tube at the patient's bedside. The correct answer is option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 87. What is the correct protocol for mixing an additive tube after filling? Option A. Shake it vigorously up and down 5 times. Option B. Roll it back and forth between your palms for 30 seconds. Option C. Invert it gently back and forth the recommended number of times. Option D. Let it sit completely still in a rack to mix naturally. The correct answer is option C. Invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 88. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A. Knock loudly, open the door, and walk right in to maintain efficiency. Option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C. Skip the patient and come back at the end of the shift without checking in. Option D. Call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 89. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C. A dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D. A clear, watery fluid component lacking any cellular proteins. The correct answer is option B. A milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 90. What type of cleaning solution should be used to disinfect a phlebotomy tray on a daily basis? Option A. Concentrated isopropyl alcohol. Option B. A 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Option C. Warm water mixed with mineral oil. Option D. Liquid hand soap solution. The correct answer is option B. A 1:10 dilution of household bleach or an EPA-approved hospital disinfectant. Phlebotomy trays should be disinfected with a bleach dilution or EPA-approved hospital disinfectant. Daily and visible soil cleaning reduces transfer of bloodborne pathogens and environmental organisms. Water, mineral oil, or hand soap alone does not provide adequate surface disinfection. Question 91. What is the standard gauge size of a needle used for routine adult venipuncture in most clinical settings? Option A. 18 gauge. Option B. 21 gauge. Option C. 25 gauge. Option D. 16 gauge. The correct answer is option B. 21 gauge. A 21 gauge needle is commonly used for routine adult venipuncture because it balances adequate flow with acceptable patient comfort. It is large enough to reduce hemolysis risk in normal veins. Smaller gauges may be used for fragile or small veins, but they are not the routine default. Question 92. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A. The skin has developed calluses that block capillary action flow. Option B. The child's heel bone is too small to locate accurately. Option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D. Walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, Ill tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Venipuncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 93. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 94. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A, prolonged tourniquet application past 2 minutes. Option B, chilling the specimen on an ice slurry. Option C, using a 21-gauge needle on a large vein. Option D, failing to wipe away the first drop of blood during a finger stick. The correct answer is option A, prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 95. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A, proceed quickly with the puncture before they pass out completely. Option B, terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C, instruct the patient to take deep, rapid breaths to hyperventilate. Option D, give the patient a glass of hot water to drink immediately. The correct answer is option B, terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 96. What should a phlebotomist do if a patient states they have a history of severe syncope during blood draws? Option A, perform the venipuncture while the patient is standing up to keep them alert. Option B, place the patient in a recumbent, supine position on a bed or reclining chair before starting the draw. Option C, tell the patient to close their eyes and hold their breath during the puncture. Option D, request a doctor to administer general anesthesia before the draw. The correct answer is option B, place the patient in a recumbent, supine position on a bed or reclining chair before starting the draw. A patient with a history of severe syncope should be positioned supine or reclined before collection. This reduces fall risk and supports circulation if fainting occurs. Standing or breath holding increases danger and should be avoided. Question 97. Which of the following structures is an example of an unoxygenated blood carrier? Option A, pulmonary vein. Option B, aorta. Option C, superior vena cava. Option D, brachial artery. The correct answer is option C, superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 98. Which of the following tests requires a plain red top tube with no gel or additives? Option A, complete blood count, CBC. Option B, type and screen. Option C, certain therapeutic drug levels that bind to gel barriers. Option D, plasma glucose tracking. The correct answer is option C, certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 99. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option of light blue top. Option B, lavender top. Option C, grey top. Option D, green top. The correct answer is option C, grey top. Grey tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing grey tubes too early increases additive carryover risk. Question 100. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation.